Yes, doctor. You can start.
Okay, so we'll go to the second part, and I hope we get it quickly. We're going to talk about here stress and addiction. We have 3 slides from here, then we'll move to the next slides. So the enemy of dopamine is stress. Stress is the enemy of CRH. CRH was a stress hormone, the enemy of dopamine. That's why most patient, let's see, you have a patient who is alcoholic, a patient who is a smoker, a patient who is drug addicts, and then he quit and was able to quit using the drugs. Few years later, he started again when he have any stressful situation. Somebody died, lost his job. Any stress will make them go back and use the drugs again. So most people relapse in using drugs when they have any stress in their life. Why? Because the enemy of uh, drugs is the enemy of dopamine is CRH. CRH is the one that lower our dopamine. Dopamine is our the enemy of the CRH. That's why if you are living normal and your dopamine level is normal, you have any stress will lower your dopamine. So you want that dopamine to quickly go back. And the only way to quickly make dopamine high again is using drugs and using alcohol or smoking. Because once you are stressed, you cannot enjoy anything under stress. Let me give you an example. Here is the nucleus accumbens. When you are stressed out, your nucleus accumbens becomes so sensitive to dopamine, and you need dopamine very, very quickly. Give you an example. If you don't sleep the night before, you're going to see it later on when you be on call in the hospital. If you stay all night, the next morning you're going to eat anything. Why? You become so hungry because your dopamine was not filled during sleep. So you're going to fill it again by food or by smoking heavily to compensate for that dopamine loss in your brain. Let me give you a final case of one of my friend. Let's name him Naeem. Naeem is a 40 years old guy who had very, very stressful relation with his wife. They fight all the time. Now Naeem was given assignment to be in a very high position. So they want to give him very high position, very prestigious position, but very stressful at the same time. So he came to my office. He said, Dr. Ali, I want to ask you, should I take this job or not? I told him don't, not to take the job. He said, why? This is very good. I'm going to be like a very high position CEO of a big company. I said, don't take it. And he said, why? I told him, because you are fighting with your wife all the time. This is the way at home. What happened when you have stress at home? Your dopamine level is very low. You're going to go to work and you're going to have a very stressful job, and it's going to make your dopamine lower. So you are low dopamine at home and low dopamine at work. This low dopamine is going to make you live miserable, and you're going to have a heart attack, because life without dopamine is very, very stressful and very unenjoyable. So either if you want to stay in this job, you need to leave the wife and marry another one, maybe it will be less stressful. Or if you want to stay with the same wife, you need to have less stressful job. That's why in America, if you notice, most people, like, they finish work at 4, you go to the restaurant between 4 and 6, they have what we call happy hours. They drink some alcohol, raise dopamine a little bit, and then go home. Here we don't have that, and I wish we don't have it, because alcohol is the worst thing you can do to yourself. So here is, I told him, you either have to change the wife or change the job, because if you want to stay with the same stressful wife, she's gonna lower your dopamine, and the job will lower your dopamine, so you're gonna be miserable without dopamine. And he didn't listen to me. He took the job, and he had 2 heart attack later on after that. So let's move to the next session, which is the second session we have about the, uh, let me see here, the addiction. So here we're going to do part 2, and I will share the slide here. Uh, so share the slide, and this is the slide here. Do you see them, the slide now?
It's starting. Uh, yes, I can
Part
see
2,
that.
you see part 2?
Yeah. Make it
Okay,
look.
so part two, we're going to talk about the drugs that available on the market: alcohol, opiate, cannabis, cocaine, amphetamine, sedative, hypnotic. We're not going to be able to make all of them. We're going to talk about some of them. So the most important things to understand here that uh, if you are a teenager and use drugs, it's going to affect you a lot more than an adult who using drugs, because as a teenager, if you are before age 25, then your brain is under construction. So when you use drugs in this age, is going to be part of you. For example, patient who start using drugs and alcohol at 15 or 14, it will be part of their system. They cannot stop using that drugs or smoking. If you start smoking after 25 or after 30, then it's much easier for you to stay away from them. Why? Because your brain had fully developed. So once you use anything when the brain is under construction, it will be very hard to leave because it's part of you now. It's part of your brain chemistry. It's part of your brain development. What is the sign that your son or somebody is using drugs? One of them is increased irritability and agitation. So they become a little bit more, you see your teenager become more irritable, more angry, not easily soothing down, don't have any motivation. Remember, because dopamine is what give you motivation, and drugs kill your dopamine system. They increase it in the beginning, but they destroy it later on. They have decrease in attention. They might have red eyes, which is related to marijuana use, low motivation. They have this what you call amotivational syndrome, and they become more irritated. Let's talk first about alcohol. Why alcohol? Because alcohol is the most commonly used substance in the world. Is the most common things. Is even in some countries more than tobacco now. Tobacco and alcohol are the highest. So alcohol work on two systems in the brain. They work on GABA and glutamate. Remember, GABA is the part of the brain or the neurotransmitter that make you calm and relax. So ethanol or alcohol increase GABA. By increasing GABA, you become relaxed and calm. And by decreasing glutamate, you become less anxious and more calm, but you pay a price that you become tired, you can go to sleep, but your memory will be impaired. That's why most patients, when they use alcohol, they have memory gap. They call them blackout. A blackout is one of the side effect of the alcohol, where you have period of time where you don't remember, your memory lapse. But why people drink despite that? Because most patients who drink alcohol, they want to forget the stress. So a lot of people will say, I want to drink to forget the stress I am in. So alcohol make you very forgetful. So you forget the stress, but you cannot just forget the stress. You forget everything else with it. So it's kind of like you cannot choose what you're going to forget. You're going to either forget everything or remember everything. So that's why alcohol is so damaging to your brain. Yeah, it makes you relax by activating GABA, an inhibitory neurotransmitter, but also it will kill your motivation and make you having memory lapse by making you forgetful and have memory problem. So this is how alcohol work. They work on the GABA receptors. GABA receptors where chloride influx down to the cell. So the more chloride you have in the cell, the calmer you are, because chloride is an inhibitory. It is what you call a negative uh, ion. Negative make the cell less active, less irritable. So that's why it make you calm and relax, and it also make you unable to have the action potential, because you remember the action potential is what activate your cells. So the when you use alcohol, you increase chloride and make the cell hyperpolarized, so it will be very hard for us to kick again. So it's like you want to run with 10 kilos on your back, it will be very hard. So the cell will be less active, and you are calm and less anxious and less irritable. So it make the cell hyperpolarized, so it will not be active as before. Alcohol, GABA and alcohol have direct effect on the amygdala. So they inhibit the amygdala, and that's why you become more calm, because remember from previous talk that amygdala is the one part of the brain that make you angry and irritable. So alcohol directly inhibit the amygdala, so you can feel calm and relaxed. They also directly inhibit the locus coeruleus, which secrete norepinephrine, so you become less active, more calm, and less agitated. That's the same way that benzodiazepine or GABAergic drugs use in your brain. That's why I use GABA drugs like Valium and Xanax to treat anxiety, because they are directly inhibit the amygdala and directly inhibit the locus coeruleus. That's why they work for panic attack. And that's why most patients with anxiety and with panic attack medicate themselves by using alcohol, self-medication. So you see most of these alcoholic patients are really patient with anxiety. They had used alcohol instead of using regular medication to calm themselves down. And they also make you forgetful. So a lot of these patients who are in bad memory, let's see, his wife left him, his significant other left him, they start drinking again. So they want to forget her. That's why, because remember, it has a huge memory in his brain. It has a lot of representation in the memory of his brain. So the problem, as we said, is alcohol is not gonna make you forgetful just for the painful things. It make you forgetful for everything, because look at the GABA receptor in the brain. This is alpha 1, alpha 2, and alpha 3 GABA receptors, and they are in the cortex. So when you use alcohol, you become forgetful, but you kind of like you lock out all of your cortex. We said cortex is the thinking part of the brain. So when you use alcohol, you become more dumb and more forgetful, because it's affecting the memory part of your brain. Yeah, they are affecting the middle part of your brain, the limbic system, but they also make you very forgetful. You are less emotional, but you are more forgetful. So you pay a very, very heavy price, because they slow your thinking down. You don't slow the thinking of painful things, but you slow every thinking in your brain. That's why alcohol is very damaging for you and your family. And here, the world, when you see somebody drunk, if you see in the movie that somebody is drunk, they are wobbly and cannot balance themselves, because alpha 1 also is in the cerebellum, where it's responsible for your balance. That's why when you drink alcohol, you become wobbly and unable to balance yourself, because that place in the brain, cerebellum, is deactivated and become inhibited, and you cannot balance yourself, and that's put you at risk. When you're driving a car or walking, you get into a lot of accident. uh, so that's why alcohol has been implicated in most car accident in the US. So in the US, if they see you drunk, you go to jail. They call it DUI, drinking under influence, because you kind of lose your ability to balance yourself, and you lose the inhibitory effect of the frontal lobe. Remember, the frontal lobe is the one that correct your behavior, and when you block the frontal lobe, you are unable to correct your behavior, and you become illogical, and you become very, very incoherent, that you don't see things the right way. And that's why alcohol has been hugely implicated in most car accident in the US. Uh, Also, alcohol affect your hypothalamus. Hypothalamus is the place in the brain that is regulate your sleep, your hormonal balance, and your appetite. So that's why alcohol affect all aspect of your hormonal balance. So you become more sleepy, you become thirsty. It affects your pituitary gland. Some people might have gynecomastia because of alcohol use. It's affect the estrogen level. Alcohol might increase your sexual desire, but it will affect your sexual performance. So you become weaker in that. Alcohol and the sleep. This is very, very important about alcohol and the sleep. We're going to talk about it in sleep disorder. So when we go to sleep, we go to stage 1, stage 2, and stage 3 and 4. This is a deep sleep. So alcohol, the problem with alcohol, a lot of people will tell you that when I drink, I can sleep. If I don't drink, I cannot sleep. So alcohol make me sleep, which is true. Alcohol is good to make you sleep. But at the same time, alcohol will not make you go to the good sleep. Good sleep is the deep sleep, the stage 4 and 3 sleep. This is what you call the deep sleep that make you relax and happy the next day. Also affect your REM sleep, the dream sleep, where you consolidate your memory. So alcohol make you go to sleep, but it will disrupt your memory. So all of the information you take from me now, you're gonna consolidate at nighttime when you go to sleep and put it in the brain as a real information. Now, if you drink alcohol, that consolidation will not happen. That's why when you drink alcohol, you become very forgetful because anything you learn through the day, you will not be able to consolidate it at night when you go to the deep sleep and the REM sleep. Because alcohol will make you go to stage 2 sleep, which is the superficial sleep, not the good sleep that God wants you to have, so you can be better and you can learn and become very, very highly cognitively intact. So bottom line, alcohol will help you go to sleep, but it will not help you in consolidation of the memory because it decreases the REM sleep and the slow wave sleep, which is very essential to consolidation of your memory at night time. And that's why alcohol looks like it's going to help you sleep, looks like a lot of people will tell you I cannot sleep without alcohol, but really they are very damaging to your brain, very damaging to your memory, and they really not helping you sleep. They are disturbing your quality of sleep. The architecture of the sleep will be disturbed, and that's why you become more agitated the next morning because you are not sleeping real sleep, you are sleeping superficial sleep. So let's see how the alcohol work in your body. Remember, alcohol is an inhibitory neurotransmitter. Alcohol inhibit the brain, so it slow your heart, slow your blood pressure, make you sleepy, and make you slow breathing. It inhibit everything. So let's see, you got used to use alcohol all the time. So let's say somebody drink alcohol every day at 5 o'clock in the evening. They come from work and they start drinking with dinner. So your body, knowing that at 5 o'clock you're gonna have some alcohol, it's already preemptively, the hypothalamus will preemptively, before you drink, it will increase your blood pressure and your breathing in anticipation that you're gonna drink alcohol and lower it down. So it's like when my wife put the food on the table just a few minutes before I come, so when I come, I can be ready to eat because she knows that food is very essential. Same thing, the hypothalamus, in anticipation for the alcohol use at 5 o'clock, it will increase the blood pressure, increase the heart, increase the wakefulness in anticipation for that alcohol, which is going to bring them back to normal. Let's see, it's 5 o'clock and you did not have anything to drink. For some reason, there is no alcohol at home. What's going to happen to you at 5 o'clock? No alcohol. Your body has already increased the blood pressure and increased the heart rate in anticipation for that 5 o'clock alcohol use. So what's going to happen? You're going to feel awful. Your blood pressure will go up. Your breathing will go high. It's like having a panic attack. Your heart is racing. You are sweating. And now you want alcohol just to feel normal. That's why alcohol withdrawal was so severe. That's why it make you feel miserable if you don't drink that glass of wine to lower down your parameter back to normal. So now you need alcohol, not just to feel good. You are not feeling good anymore. Just to feel normal, you need that alcohol just to feel back normally. That's how damaging the alcohol is. Now you become an alcohol dependence. That means you cannot live without alcohol. Now, the most damaging things in alcohol, I know this is going to break your heart, but look at this kids here. This is typical, and I used to have many patients like this in America. This guy is typical alcohol mother user. When the mother use alcohol during pregnancy, this is what's going to happen. We call it alcohol fetal syndrome. So alcohol do permanent damage on the women when they are using it during pregnancy. It will do permanent damage to the baby. So this is the alcohol syndrome, alcohol alcohol abuse syndrome in the guy, fetal alcohol syndrome. And you see that the short palpebral fissure, the flat mid face, the short nose, the thin upper lip, microgenethia, all of these symptoms of the mother using alcohol during pregnancy. This is very important. I want you to know it very well because they usually come a lot in the exam about this, please. So what happened when you use the alcohol? You have a blackout. We say the blackout because glutamate is what make you think. Remember, glutamate is how the brain talk to one another. So when you decrease glutamate with alcohol, you inhibit your glutamate and you inhibit your thinking. It will enlarge your eyes, make your eyes pupil enlarged. So this is one of the sign of alcohol use. Your eye movement will become, faster than normal, and you have nausea and vomiting, and you are wobbly because alcohol will inhibit the alpha receptor in the cerebellum, so you lose your balance. And here is the losing of balance is here. So alcohol intoxication, that's mean what we call sakran in Arabic, or drunk. Drunk is exactly like this. Your pupil is high, you might have blackout, seizure, you might do things and don't know that you are doing these things. So you have a blackout, like you might kill somebody, and you might rape somebody, and you don't remember it because you don't have memory of the event. That's why a lot of rape happen in the college party in the university in America every year. Like a couple of thousand women got raped during the party of these universities, and they have a huge backlash over it now, because a lot of rape happen because they are drunk and they don't remember what happened, and all of these things happen during the blackout where they don't remember things happening. And you might have car accident on the way home because your balance is disturbed due to the effect on the cerebellum. Uh, and the rape usually happen, and you, because you lose your frontal lobe inhibition. So the frontal lobe is what make us do the right things, and when you drink, you kind of remove the frontal lobe. That's why a lot of people, like, you see a lot of performance, like singer, people who do comedy shows, people who want to do social talk, they cannot do it unless they drink some alcohol, because the frontal lobe is the one that is the brake of your brain that make you do only the right things, and sometimes it will inhibit you from seeing things, saying things, or do things. So you become more sociable when you drink that alcohol drink. You go and approach women, like if you are shy and you cannot go to ask the woman to talk to you, if you drink some alcohol, it will remove the frontal lobe inhibition, so you can go talk to them and make you more social. The problem is it's not make you social only, it make you forget what you are doing, so you might end up raping her or doing something bad to her without realizing that you are doing that. uh, and when you are driving, you might have DUI. DUI is when you drink under the influence and have car accidents. So every state in the US have a limit, like one beer will make your blood level 0.08. So it's really very strict on that in the US for that blood alcohol level. So we said that when you lose that frontal lobe inhibition, you might become quick moody, so you become open and flirt with women. You become have moody and start joking and start making a lot of noise around you. You might have risky sexual behavior because you had lost that frontal lobe inhibition because of the intoxication. So what is the sign of withdrawal? This is also very, very important in the exams. Sign of withdrawal is like same like panic attack. Remember, we said the amygdala will start having all of this messy feeling for that alcohol because it got used to you for a long time. And we said our body already raised the blood pressure, raised the heart rate in anticipation for the alcohol. So when there is no alcohol, the heart rate will go up, and norepinephrine go up. When you have norepinephrine go up, you have sweating, palpitation, muscle tension, tightness of the chest, tremor, nausea, vomiting, anxiety, restlessness, insomnia. All of these symptoms of panic attack, but it's related to lack of alcohol use. So the first hours, you might have some anxiety, GI upset, headache, palpitation. 2 3 hours later, if you stayed without alcohol, you might have alcohol in what you call it, withdrawal symptom, hallucination. Then you have DTs, is the most dangerous. If you stay like 3 4 days without alcohol and you are an alcoholic, you might go to DTs. DTs is very dangerous because it has very bad morbidity and mortality. So you need to know all of these withdrawal symptoms. Start by 8 hours, then go to 3 days, 1 week, and then after 1 week, if you don't drink alcohol, you're going to have severe DT, and a lot of patients will die from DTs in those patients. So always when you see a patient in the emergency room and he is like very anxious and having panic attack, first thing you need to rule out is alcohol withdrawal, because it's very, very common, especially in the West. Here is not that much, but if you go to America or England, remember most patients drink there. The rule of the people there, they drink alcohol all the time. I remember, just this is a real story. I went to Dublin 5 years ago. I was in a meeting, big meeting in Dublin, and we were 300 psychiatrists in that meeting. And I'm the only one who came from here, from the Middle East. So that meeting, we they took us to dinner, and I swear to God, I am the only one who ordered Diet Coke in that meeting. Everybody else order champagne and alcohol, and we are psychiatrists. We are supposedly not letting people drink. So all 299 psychiatrists order beers and alcohol. I'm the only one who ordered Diet Coke at that time. So this to tell you that I didn't order a strawberry, just a Diet Coke. So this is how common. So when you go to America or go to England or to Germany, you have to assume that everybody drink. 99% of the people there drink alcohol on daily basis. So you have to put it in the back of your mind every time you see somebody who is agitated, anxious, angry, having any panic or withdrawal symptom. This is has to be on the back of your mind. So this is the sign of withdrawal. We said minor things in the beginning, then major, then delirium, DTs after 48 hours from using alcohol. And we said DTs is very important because it's life-threatening, it's emergency uh, things. So in the beginning, they will have like autonomic hyperactivities, tremulous, tachycardic, GI upset, insomnia, vivid dream. Then they go to hallucination and seizure. Then they go to DTs, because you have to know it beforehand so you can treat the patient. This is the DTs. It's very, very dangerous. Usually DTs, delirium tremens, happen about 24 to 48 hours after the last drink. So what is the blood alcohol level in DTs? It will be zero, remember, because you don't have any alcohol level in your system. So the first thing, you check his alcohol level and it will be zero, and the patient will have history of alcohol use. Then you treat him. There is a certain protocol to treat DTs, like you give him benzodiazepine like chlordiazepoxide or diazepam and thiamine and magnesium. I'll put you all of that in here. So this is the treatment for DTs or any patient with alcohol withdrawal. Lorazepam, diazepam, or chlordiazepoxide, one of them is enough. So most hospitals have like protocol, like you develop your own protocol. Like my protocol used to be lorazepam, but you have to give it every 2 hours IV, every 2 hours to prevent DTs. Diazepam can be given oral. Chlordiazepoxide, you can give it daily because it has long half-life. Thiamine, you have to give thiamine vitamin, beta blocker to decrease the heart rate, valproic acid for seizure, and haloperidol for agitation. So everybody will develop his own parameter for DTs. But this is very, very important because a lot of question in the exam about it, because DTs is potentially life-threatening. Most patients will die if they don't get treatment easily and quickly from the DTs. And remember, maybe here is not very common, but once you go to the US, or Germany or England or wherever, it's the rule. Most patients there are alcoholics. So if of course they have alcohol everywhere, so they will not run out of alcohol. But just in case for some reason they couldn't drink, or they traveled, or they couldn't go to the grocery store to pick some alcohol, they might develop DTs, and they might get alcohol withdrawal symptoms. Mortality, as we said, in DTs is very common, up to 40% sometime. They die of cardiac arrhythmia, cardiac failure, infection. In fact, there is a good question. They might ask you in the exam, what is the most common cause of death in alcoholic patient? It's not liver cirrhosis, although a lot of patients who uh, drink alcohol will develop liver cirrhosis. But liver cirrhosis is not the reason why they die. They die mainly from cardiac failure, because alcohol is very, very toxic to the cardiac muscle. So cardiac muscle is where the damage happened from the alcohol, and they might die from cardiac failure or infection or whatever. This is very nasty syndrome called Wernicke Encephalopathy, and you see this white spot near the ventricle. This is very common in Wernicke encephalopathy. It's called the triad of Wernicke encephalopathy is oculomotor abnormalities, ataxia, and altered mental status. So when you are in the ER and you see somebody with confusion and ataxia and oculomotor activities, their eyes is nystagmus and moving in the left and right direction, this is typical of the Wernicke encephalopathy, and the treatment is IV thiamine immediately, because it's lack of thiamine. It's very common in the West, we said, and you need to treat it quickly in the treatment. So let's go to marijuana. Marijuana is now very common in the US and Canada and Europe. They are using it more frequently now. They are legalizing it for some reason. So what happened is marijuana, in a nutshell, it will move this guy on the left here, who is very happy and active and energetic, to this guy here, what you call it, amotivational syndrome. He become just careless. Look at his face, is called stoned face. Stone means the face become like a stone, no feeling whatsoever. He become passive, inward personality. He sit for 2 hours just drinking and not bother to do anything else. He does not interact with anyone. They become introverted. They become on their own feeling. They have this magical, childlike, magical thinking. It suppress all the emotion in them. They make them careless and relaxed. So they are relaxed, they are not anxious, but they are careless. They become like a stone. That's why there is a special word in America. You write in the mental status exam, he was stoned on marijuana. Stoned on marijuana means his face become like a stone, no feeling whatsoever. He's not anxious. That's why a lot of anxious people use marijuana. They will tell you it's magic for anxiety. Yes, but it's magic to also to make you like a stone, no feeling whatsoever. So this is what we call a motivational syndrome, and this is typical of that patient who are stoned in marijuana. They turn inward. They don't have any achievement. They don't like to do anything. They stop going to classes. They stop caring about their school, their activities. They regress to earlier stage of living. They become like a a stone, and like a piece of furniture. They have no feeling and no benefit whatsoever. And this is the typical the word called stone. The reason we said stone, because the marijuana inhibit the amygdala. So remember when we said when we are anxious, the amygdala is very hyperactive. So when you smoke marijuana, the amygdala will become very, very inhibited, that not only the anxiety will go away, but you don't have any feeling left. So you become like a stone, without any anxiety and without any feeling and without any motivation to do anything. This is how marijuana comes from the Indian hub. It has many, many names. Here they call it hashish. Hashish is different form of marijuana. So there is a lot of things. They call it weed, banjo, buds, marijuana. Uh, some people eat it. In fact, if you go to Amsterdam, uh, Marijuana is in everywhere, in coffee, in cake. So you have to ask for specifically. I remember when I was in Amsterdam many years ago, I told them I need coffee without marijuana, or otherwise they will put marijuana in the coffee. So they put it in everything in Amsterdam. Amsterdam is the capital of marijuana, but now marijuana is everywhere in the world now, even in the US. So it slow your thinking process, it worsen your problem solving, it lose the emotional feeling, it's affect every part in your brain, make you less verbal, memory is impaired, you are not thinking. And the dangerous is look at when you when you smoke marijuana, it stayed in your system for 30 days. So even if you smoke marijuana once a month, it's damaged like if you smoke it. Of course, it's a little bit less, but it will damage you for the whole 30 days. The problem with marijuana, the cannabinoid receptors are in the white matters here. And the white matters is very important for thinking and the process of making a new cells connection. So this is on the left, normal cells where they have a lot of connection. Here on the right is I'm sorry, on the left here, no connection. So marijuana disturbs the connection between the brain cells. And we said this neuroplasticity is very important. So when you listen to me today, you make a lot of connection in the white matters between the brain cells. All of this information you got from me today is going to make your brain cells making a lot of connection. In marijuana patient, the marijuana sit in the white matter where the connection should happen, and it will affect your memory and you affect your emotion. It will affect your thinking. That's why I think, in my opinion, marijuana is the most dangerous drugs on anybody. Why? Because it will affect the way your brain cells talk to one another. And the brain cells talk to one another is when they make connection between them. So all of this information you are learning today is you are making a new connection between the brain cells. We call that synapses connection. And marijuana will disrupt that, so you will not be able to think or feel anything later on. They are also hallucinogenic, so they make you hallucinate. That's why they classified as hallucinogenic. So a lot of patients, when they smoke marijuana, they have different feeling. They have distorted reality. They might see things that we don't see and hear things that we don't hear. So in the short term effect, they make you feel high, a loss of sensation of coordination and memory, impaired perception. You might see things and you might have a special feeling. Your heart rate will increase, and your bronchial might be more relaxed, so you can breathe deeply. And you will have red eyes because of the vessels will extended in your eyes. And then later on, you might have like symptom of withdrawal, depression, restlessness, decreased appetite. You might have trouble with the sleep. You might be irritable and anxious and angry. So it will affect all the symptom in your brain. So basically, it will irritate your lungs. So if you have asthma, it might affect you a lot worse. It will increase your heart rate. So you might put you at heart attack risk. You might become psychotic, like we said, sometimes make you hallucinate and feel paranoid. It will impair your judgment, impair your coordination. You might have cough and lung problem related to the marijuana use. So they are affecting the brain, the lung, and the heart in very, very different way and form. And we said in using it as a teenager, it will put you at risk of a lot of illness. One of them is schizophrenia. There is a strong correlation between marijuana and schizophrenia. It's still not clear correlation, but it's really, in some cases, are a very, very strong cases of teenager who use marijuana and they become schizophrenic. We don't know exactly the mechanism, but it's one of the factors that do that. It will decrease your cognition as a teenager. And as a teenager, your cognition is your asset. You want to be a doctor, you want to be an engineer. So if you smoke marijuana, it's going to affect your ability to think and judge things in the right way, and it will affect your academic function. And they used to call marijuana the gateway to drugs. So you start with the marijuana and then you go on to use heroin and cocaine later on. So they call it the gateway drugs to other drugs. And a lot of patients might kill themselves to increase suicidal risk in some patients. Now, marijuana has benefit, and there is a medication in America we've been used for a long time called Marinol. So marijuana has some benefit. It's like, the venom of the snake has benefit. They use a lot of medication from it. But if the snake bite you, it will kill you. Same thing in marijuana. So marijuana has been used in pain, cancer patient, AIDS patient. They use marijuana to make them eat and make them relax and make them calm. So this is a good use of marijuana. And that's why marijuana has been FDA approved for medicinal use. But the problem with people are using it for recreational use. So marijuana here help you with the pain. So they will respond who had patient with severe chronic pain. They might benefit from marijuana. Nausea and vomiting, like with cancer patient, it can decrease by marijuana. They might stimulate your appetite. So most patients with AIDS used to die from wasting syndrome where they will not be able to eat. So marijuana will help with that. Some patient with epilepsy might benefit from marijuana. And they have several studies to show that it has some benefit. So the problem is, it's like anything on earth. If you use it the right way, it will be beneficial, but most patients will use it in a recreational way, and there will cause a lot of damage. So marijuana is addictive. It's not as addictive as other drugs. It doesn't have withdrawal symptoms severely like alcohol. So if you stop using marijuana, you're not gonna die. If you stop alcohol or cocaine, you might, but in marijuana, you're not gonna die if you stop marijuana. So you might feel a little bit irritable, decreased appetite, anxiety, but there is no treatment for it. You just have to live without marijuana for a while. Uh, as we said, if you use marijuana heavily, it will affect your physical health. You will be less able to finish academic function, and it will affect your school performance. But marijuana is not highly addictive. It's only 9% addictive, while Keptagone is like 90%. So this is a huge difference between Keptagone and marijuana. Now we'll move to cocaine. Cocaine is very highly addictive drugs. In fact, if you look at most of the people celebrity who die, they will die from cocaine overuse. I'll show you later on how, like Whitney Houston, if you remember the singer Whitney Houston, if you remember Chris Farley, he is a comedian. All of these celebrity died from marijuana or from cocaine overdose. So cocaine is very dangerous drugs. And it causes death in most patients. It will increase the risk of suicide. It will cause a huge euphoria like Keptagon. It stimulates your whole body. It increases your body's temperature. It will increase your heart rate, severe nausea, but it gives you a severe feeling of high that is not available anywhere else. So this is how marijuana can kill you. Marijuana do brain damage because of the increased blood pressure. So most patients with marijuana, with cocaine, and now we're talking cocaine. Cocaine can kill you in many ways. Remember, cocaine will increase your heart rate and cause constriction in your arteries. So what happens when you have increased heart rate and constrictive arteries? You're going to have stroke. So the vessels is getting a lot of pump and it's constricted, so it will explode. And that's why most patients with the cocaine, they die from stroke, like Chris Farley and Whitney Houston died from stroke related to huge amount of heart rate increase and vessel constricted, so the vessel will damage. Overheating. So marijuana will make your temperature very high, and overheating is one of the reasons that might kill you. So here we said that marijuana, cocaine. Look at this phrase here. I want you to read it carefully. Cocaine can kill you in variety of ways. Most commonly, heart attack, overheating, hyperthermia, and brain damage. After taking even a low dose of cocaine, you are 24 times more likely to die from heart attack. So even if you take tiny little bit of cocaine, you increase your heart attack death by 24%. 24 times, I'm sorry. So if you smoke even a tiny little bit of cocaine, your heart attack death rate increased by 24 times. Why? Because your heart is pumping too fast, too quickly, and your vessels are constricted, and you're gonna die quickly. That's why most patients who use drugs, cocaine is the one that increase your risk of suicide and increase your risk of sudden death. So I bet you money most of these patients who die quickly, they die from cocaine overdose. A lot of celebrities. Now we'll move to opiate. Opiate is very commonly used in the US. In US, it's pandemic. A lot of patients use heroin and pain medication. It's taken from opium poppy in Afghanistan, and they use it in many places in the world. And they usually most patients will start using opiate by eating them as a tablet. So they take pain medication. They become abused to pain medication. But if you abuse pain medication by stomach, after 6 7 months, it will not have any high effect. So you want to snore it. So most patients, they start by using the tablet by mouth. A month or two later, it will have less effect. You build tolerance for it. Now you have to get it more quickly. So you start snoring it. So they crush it and they snore it to get it fast to the lung. And then after a month or two, it will not be effective. So now they inject themselves with the opiates. So you start with pill, you end up with the I'm sorry, with the snore in it, and then you have to use it IV. An IV drug use will put you at risk of AIDS. In fact, most patients in America who develop AIDS is develop AIDS not by sexual activities, but by using drugs IV because it's very common. That's why in like Amsterdam, they used to give patient clean needles so they don't use the needle of other people and get infected with AIDS at that time. So we said swallowing, smoking, then IV, because IV is the quickest way to the brain. It get there in 2 seconds, while smoking, it might take a few seconds to get there. So usually they swallow it with alcohol, and this combination is very deadly for those patients, as we see. So here is, it will affect the Nicholas accumbens and the ventral tegmental area. So always there is high from the cocaine. So it starts with the ventral tegmental area, goes to the Nicholas accumbens, and this is where heroin work on the Nicholas accumbens and in the ventral tegmental area, increasing dopamine, and that's why you feel high on those drugs. Abusing pain medication is very common in the US. So there is two states very, very common in US in using opiate. It's called state of Virginia and state of Tennessee. This area where I used to live is very common epidemic for pain medication use in that area of the world. The medication make you feel high. It slow your breathing down because remember most patients with heroin addict die from heart attack because they stop breathing. So if you take way too much of heroin, you stop breathing because they inhibit the brain stem breathing part of the brain. But they make you feel high because the heroin also increase your joyful feeling by increasing dopamine in the nucleus accumbens. They decrease your pain. That's why they use it initially for pain, because pain is through the spinal cord, and the opiate inhibit the spinal cord, so you don't feel any pain. What is the best treatment for uh, opiate addiction is medication called Suboxone, buprenorphine. This is a medication, and it's for you who are gonna practice in the US. This medication is not available in Saudi. I think it's available in some places, but it's a pain medication. It's a partial agonist of opiate receptors, and it's the best treatment for drug addicts. This is the medication that really help patient with pain medication addiction. Uh, and usually you get a license to prescribe that medication. So they call you Suboxone license. So you get a special license to write that medication. And then you have a clinic where patients who are drug addiction like opiate, they come to your clinic and get prescription for Suboxone. The good thing about Suboxone, it make you feel normal again. So this is the only addiction that make patient feel normal again. If you use the Suboxone, you will not use the opiate again, and you will get rid of your addiction habit. This is the best thing happened to psychiatry in the last 20 years is the invention of Suboxone, because it's really got most of these patients who are abusing drugs to be normal people like me and you. So instead of being addict to heroin and cocaine and pain medication, if you take this medication, it will it will prevent you from using these drugs and make you feel normal again. So I will leave the panel now for question and answer, and I want to thank you very much for the help. Thank you.
Thank you, Dr. Ali. There are a few questions here.
Now
Just
they asking about methadone. Methadone is the one we used to do before Suboxone. So methadone is the old treatment. Suboxone is the new treatment. Okay. So it's like methadone is like the Nokia and Suboxone is the new iPhone. So nobody use methadone anymore. Most of the treatment now is Suboxone. Patient
um,
develop reliance on Suboxone. Suboxone, you give it to the patient for 1 year, and after 1 year, they will be able to get rid of it and become normal again. They said here 10 mentally ill patient only in a few places. We said that marijuana use in terminally ill patient to help them eat and sleep and help with pain. Doctor, if somebody have high libido and sexual drive, can they weaken frontal cortex like some drugs? Yes, but this is we'll talk about it later on, inshallah. And do they get high from Suboxone? No, Suboxone will not give you the high feeling. It just decrease the craving. So when you take Suboxone, you don't take pain medication because it will decrease the craving for pain medication. So pain medication become like the strawberry or the cucumber. You can live without it. So it will decrease the craving. You need to know the full treatment of addiction, mainly for the alcohol. So DTs and alcohol withdrawal, you need to know very, very well all the treatment. You need to know it by heart because there is a lot of question from that. Okay, they said there is a lot of question from earlier chat. If please, if I don't answer you, please send it to me by WhatsApp, and I will try to go there. Camera icon. Okay. No, the basal ganglia is the high is in the nucleus accumbens and the stratum. These the two part are part of the reward system. The stratum, which is part of the basal ganglia, and the nucleus accumbens. Substantia nigra and ventral tegmental area are the same. It's like al khubar and the dammam are the same place. Uh, okay, let me answer most of the question. Where are the nucleus accumbens located? So it's located near the stratum and the amygdala. It's in that part of the brain. Yes, we have two nucleus accumbens and two putamen and two part of the brain. Okay, what is the, okay. I guess substantia nigra nucleus is located. So substantia nigra and nucleus accumbens, I'm sorry, substantia nigra and ventral tegmental area are in the midbrain. They are in the same location. We said it's like Al Khubar and Dammam, or Breda and Aniza are the same place. Yes, every substance that increase dopamine reaches that area. So anything that increase dopamine in that area of the brain cause addiction between the nucleus accumbens and the ventral tegmental area. This is the highway, the pleasure highway. So release dopamine when we are eating, continue to eat. Yes, that's why we eat. The reason why we eat is because food make our dopamine higher. About wet and cold, there's a huge lecture about that. I'm sorry I couldn't give you this, but always hot food make you more happier. That's why you always say warm welcome. Always I say don't invite anybody to ice mocha. Always invite them to cappuccino, hot cappuccino, because they found out that hot liquid make you more warm and more friendly. Cold liquid make you more cold. So please, when you invite somebody, always we say have a warm welcome. We're gonna say a warm welcome. That's mean warm is much better for the Nicholas accumbens than cold things. So testosterone will prevent the frontal lobe from supervising the Nicholas accumbens. So when testosterone is high, the frontal lobe cannot work. That's why God doesn't want us to sit a man and a woman at the same place alone, because when you sit with a woman alone, your testosterone will go high and your frontal lobe stop working. That's why God does not want you to sit with a woman alone, because your frontal lobe will not be able to handle the urge which is coming from the Nicholas accumbens. We're gonna talk about it later on if we have time later on. So Captagon is one of the main thing. Methamphetamine is one of the part of the medication called Captagon, which is street drugs. So Captagon has many substances. One of them is methamphetamine. The receptor destroyed because you overwork these receptors. So after many years of using the drugs, you kind of overwork the receptor and they start dying quickly. Same like Parkinson. Parkinson patients don't have any dopamine, but in addiction, the dopamine is in the Nicholas accumbens, while in Parkinson, the dopamine in the basal ganglia. So they are different places, but it's the same dopamine. We left with no dopamine. Okay. Yes, that's great question. I'm glad you asked. They said, do you mention that without dopamine the frontal lobe cannot work, but when you alcohol increase dopamine? So this is the idea. In the beginning, when you drink alcohol or drugs, you increase the function of the frontal lobe. You become very productive. You become normal. But these dopamine cells, you are overwork them. Later on, they will die quickly, and then there is no dopamine left. So in the short run, they help you. In the long run, they destroy everything, and you don't have any dopamine left. So I hope, I'm glad you asked this question. So in the beginning, when you drink alcohol and use drugs, it will improve your cognition and function of the brain. Frontal lobe rely on dopamine. But after 2 or 3 years from using these drugs, you don't have any dopamine left in the brain. So the frontal lobe stop working. Coffee is addictive. They cause anxiety, but coffee will not increase your dopamine like the Captagon. So it will increase dopamine in the normal range that God wants us to increase. So food, sexual activities, chocolate, strawberry, all increase dopamine, but they will not damage your brain because they don't go to the toxic level way beyond ability to handle. So we stay in the normal range. We said theoretically the normal range between 100 and 300. But when you talk about Captagon is like 2 or 3,000. That's why it will destroy that part of the brain. It's not weaker than limbic system. Is the frontal lobe should supervise. They work hand in hand. So the frontal lobe work with the limbic system in adjusting our needs. So when I'm hungry, the frontal lobe want that dopamine to feel normal. The limbic system will agree with that. But when you are addict, the frontal lobe is unable to supervise that frontal lobe. So you get in trouble because there is no supervision. So you eat too much, or you drink alcohol, or you do something that damage you. The frontal lobe want to do things that keep you alive and happy. When you lose the frontal lobe, These things you are normally used to make you happy and normal, they become more damaging because they are not supervised by the frontal lobe. A treatment of addiction will make you better, but the changes happen in the brain will be permanently changed. So you will never be back normal again. You will live normal in your standard, but it's like we said, somebody who had broken legs, they learn how to walk even better with the broken legs. But they have, to walk with the broken legs, not normal leg. Yes, so most patients who drink alcohol and recover, the only thing that make them go back again is stress, because the stress will lower dopamine, and the lower dopamine will make you more in trouble. Coffee's addiction should be in a special subject, but coffee will not damage your brain. In fact, coffee is good for you because it will not increase your dopamine to a high level like we said in the other substance. I think, yes, nicotine is very, very addictive. Nicotine is as addictive as anything else. I will stop here. If you have any question, please send it on my WhatsApp, and I will be very happy to answer it. Don't hesitate to do that. Do you have any other question, guys?